Welcome back to another episode of Caffeine and Concepts, where bold ideas meet real world impact. And we sit down with those who are reimagining what leadership, care, and purpose looks like today. Today's episode hits close to the heart. We're talking about a word that instantly changes lives: cancer. And we're doing it with someone who is not just treating it in hospitals and infusion rooms, but also redefining the care experience itself. Dr. Sarah Cookfriend is a triple board certified breast oncologist with over a decade of experience in clinical care, leadership, and cancer research. She spent nearly 9 years at Emory University Winship Cancer Institute, where she served as an assistant professor and associate medical director of ambulatory infusion services. Today, she practices at Phoebe Putney Health Systems while also leading My Friend MD, a personalized cancer coaching service she founded to give patients extended one on one expert support that the healthcare system often doesn't allow for. Dr. Friend is also a consultant for the health tech startup Care Crowd and the nonprofit Cure Childhood Cancer. Her work blends clinical excellence with education and advocacy, helping patients and families navigate some of life's most difficult moments. She has earned national recognition for her compassionate approach to care, including top doctor honors and Emory's prestigious Diamond and Platinum Provider Effort Awards. In a world where the system often rushes, restricts, or overlooks the human behind the diagnosis, Dr. Sarah chooses to pause, to listen, and to build something better. Today, we dive into her journey, why she chose oncology, what led her to launch cancer coaching practice, and what she's seeing as cancer case rises. Care model strain and patient seeks more than just treatment. They're seeking connection. Welcome to Caffeine and Concepts, Dr. Friend.
Hi, thank you so much for having me.
We're so excited about today's session, and I know it's going to be a heavy duty session. So I'm going to kind of start off, ease into this with some rapid fire questions before we, get into the meat of things. You ready for that?
Yeah,
Awesome. All right. Uh, One word your patients use to describe you.
caring,
Perfect. I can see that. What's your superpower as a doctor?
listening,
First thing you do after a long day on oncology.
take a long shower. I started that after COVID, where at one point we thought we were bringing germs home from the hospital. So clothes have to go right into the washer and the dryer. And I got used to showering immediately and it's, it's worth it.
I hear you on that one. I used to be an extrovert, didn't realize you could change, but now I think after I come back from a full days of work, for me to have me time and quiet time, I do end up taking long showers, and they're primarily almost as a getaway of me time. So I hear you on that.
For sure.
All right, your go-to self-care ritual.
I love to garden.
Oh, all right. So what are you
Yeah.
gardening at currently?
Yeah, so my summer collection of flowers are starting to bloom from last year, which I'm excited about. So I have a lot of really beautiful cannas, roses, and then I also have planted a lot of annuals, so the marigolds, begonias, zinnias,
Oh my God.
and so it's a really colorful collection. It's not the most organized rows of flowers, but there's red here, blue here, so it's a collection.
Oh, I am sure that the wildlife around you is thanking you for that. And you
Yes.
know what? I think the organize is overrated because it's not natural. So I'm sure the collection of the yellows, reds, and whites, it must be
Yeah.
looking lovely.
Yes, lots of bees and butterflies for sure.
Oh, that's nice. Wonderful. So you're not only caring for people, but you're also caring for the environment. I love that. I love that.
Thanks.
All right. Most misunderstood thing about cancer.
It's not always fatal. I think the fear of cancer prevents people sometimes from going to the doctor or taking care of something that could have been a lot easier to cure or take care of had they identified it early. So there's a fear of getting, recommended tests like mammograms, colonoscopies, a fear of finding out you have cancer, not wanting the genetic test that could identify a cancer mutation, all of that is based on fear. But oftentimes, cancer can be cured, especially if found early. So I think, and we'll get into this more with, this conversation, but if you try to remove the fear from the word and just think about the next step, you will be better off long term. So it's not always a death sentence. It's not an immediate death sentence. And I think, acknowledging that, yes, that is a word that it has a lot of fear associated with it, but you want to not run away from it because you want to take the preventative measures that we know can reduce your risk of cancer and can find cancers earlier, um, by removing the fear if possible.
And that's heartening to hear. I think sometimes the emotion of something can be a lot more overwhelming,
For sure.
the actual thing. Um, and not that I'm belittling or making light of what we're saying, but public speaking definitely puts a lot more fear in me. So
Oh, yeah.
yeah, but
Yeah.
you start doing it and it's like, oh, it's not a big deal.
So-
Yeah, I hear you. All right.
yeah.
So let's step into the meat of the things, right? So you've been practicing for a decade now, right? And you've gone to school for this. At what point in your life did you start this journey, right? To not just to become a doctor, but specifically within this field. Like what started that from your early, I guess, childhood memories?
Yeah, so there were a few things. So first, I'll make mention that the oncology field is paired with hematology. So that's like blood clots, anemia, people that need iron. So if you select hematology, you're often going along with oncology as well, vice versa. So I found out at a young age that I have a blood clotting disorder that runs in my family. And my dad and my grandpa are physicians, so I was interested in medicine at a young age. But then once I started going through my medical training to decide which field to go to, and I would mention this clotting disorder, all the hematologists thought it was so cool. So they would want to, teach me about it and sort of took me under their wing. And I think that mentorship really shaped my decision. In addition, we had a couple of really close family friends. My dad's nurse, as well as one of my best friend's mothers, who unfortunately had cancer. And I just was there for their families the entire journey. And it really impacted me. But I think it also just led me to oncology. So once I could find that there was a field that combined both my unusual clotting disorder with the um, the the strong desire to help people, especially in oncology, I think it was a match for me. But it's not without intensity. So it's certainly a very heavy job that requires a lot of um, a lot of, like you said, self-care and compassion and a lot of emotion that I think maybe some of the other specialties wouldn't have wouldn't have had as much of. But both of those things made me go into oncology and hematology.
And how old were you at that time? Because that's a lot to not only for yourself to deal with and break down, but also to your point about your friend's mom. I mean, that's a lot for a young age. How old were you at that time?
Yeah, so she was diagnosed when I believe we were in high school, or maybe it was the end of middle school. So but then coming from a family of doctors, have been able to, you know, understand things like, hard work and, sacrifice and putting others first in terms of the lifestyle of some of my family members. So again, the idea of being a doctor was early on, but the idea of cancer was shaped probably in high school and then moving into college.
And that, oh my God, I know medicine is a really long journey, and to your point, it's a very stressful journey as well, especially
Yeah.
with the kind of focus that you've had. Did it, at any given point during, that what it's over a decade, right, of studying, so 14 years, if I can do my math clearly. Did at any point in time did you ever feel like, "Oh my God, I wish I wasn't on this and I wish I had thought about something else?"
You know, as soon as you take that first student loan dollar, you're really stuck because the amount of money that it takes to get through training is so high. It takes you years and years and years, if you're lucky, to pay it off. And so by the time, I mean, it's almost like balancing a tightrope, where if you look this way or this way, you could panic if you realize what is ahead of you. But um, at the same time, backing out while you're several years of medical debt in would be just catastrophic. I mean, it's hard to imagine starting over at that point. So I think all of us in medical school, you know, depending on the severity of that rotation or a particular weekend of, just a lot of intensity, have thought, wow, is this really what I want to do? But at the same time, it's very difficult to back out at that point. So I think, yeah, I think it's crossed my mind. It probably has crossed lots of people's mind. Like, is this really what I want to do? But at the end, it's like my heart was always with my patients, and that sort of could, bring me through. Feeling like you're helping someone in their time of need. It's really rewarding, and not many jobs, you can feel like you make such good in a day to day, um, in the day to day. So I had questioned it occasionally, but for the most part, I was really confident in my decision.
Oh, I love that. I love that. It takes a different kind of passion and person and focus to do that for this long. And you're right. I think the impact and the result definitely makes a difference. You had been practicing at Emory for almost a decade, right? And
Okay.
tell me a little bit about that journey, and then we'll talk about the transition to the next step. But tell me a little.
Yeah, I mean, I love Atlanta. My husband and I went to college at Emory. We love Atlanta. So when looking for jobs, I had always known that I wanted to be a breast cancer doctor. And so the job opened up where I could join the practice at Emory and be part of the breast cancer team, which was really rewarding for me. And I've, loved my time there. I've loved my patients. I've loved my staff and my peers. Um, and I found that for me as a human, um, I loved, loved, loved the very first visit when I get to meet someone and I get to use an internal desire to teach. So I have a lot of like patient handouts, and I would, basically go over the plan. That first visit is a meet and greet where you also go over the plan for whatever you're doing. And so getting the opportunity to educate with that first visit and then really get to know someone, I just loved that. And what I found as my practice built, and I got busier and busier and busier by year, 8.5, you're so full of patients that you're not able to spend an hour with someone anymore who might need it. So also the connection, gets less and less as you're working within a system. And it's not one specific system, it's just the role of being a doctor. Your follow-up visits tend to be 10, 15, maybe 20 minutes. Um, but to me, it was just not enough time. So while I absolutely loved everything that I was doing, I loved my line of work, and I really felt like I was getting an opportunity to make a meaningful impact. I felt led at that time toward my last years to find a role that could fit my long-winded personality and give me the opportunity to connect to people on a longer basis, and taking from my own therapy, it takes several minutes, at least 20 minutes to even get out the problem that you're trying to address. So in the world of cancer, where this is often the most important thing in someone's life, rushing them, it just felt wrong, and it felt like bad customer service. And there's a lot of my colleagues who do it in stride, and they're really good at it, and they do give great customer service. They're just able to, work within that field, or within the confines of the time limits. But for me, I just wanted to explore a new idea of trying to expand the time limits and see if I can find a way to offer support to people going through their journey that supplements those 15-minute visits that people are getting, because it's still needed. I mean, if you're going to get people in your clinic, like who need to be seen, then you have to shorten visits to make room for more people, right? So it's a good thing to have doctors available for their patients, but you can't be available for an hour at a time with each patient. The math just doesn't add up. And so for me, now in a cancer coaching consulting role, which obviously we're going to get into, I just started just thinking that I could create something that could work along with the traditional medical team that I know could be a good asset to it.
So I love this. I love the growth and the conclusion of that growth of giving back, and um, the idea of my friend Andy being born out of that. Um, so tell me a little bit about the program itself. Like, what does it offer patients? Give me a little bit of what are they getting in addition to um, the other 15 minutes that that you've already spent at a clinical level? What does my friend the MD offer?
So my friend MD, and myfriendmd.com is a website that people can go and book sessions to discuss various topics depending on where they are in their journeys. So in this role, there's no prescribing medicines, there's no making diagnoses, but what there is support and clarity, um, depending on the time. So, example, somebody may have found out that they have breast cancer. They may not exactly know their stage of breast cancer yet, but they might have a lot of questions about the what ifs and what will my treatment be like, but they just may not have heard that information yet because, the surgery hasn't happened. We don't know the full tumor size. We can't give you your stage yet, but until that happens, you may be really, really, really stressed out and panicked. So, booking a session with me, I have lots of education on these topics where I can say, we might not have all the information now, but these are the really important concepts that you need to understand to really maximize that visit when you do go to see your doctor, to make sure it's fruitful and productive and you get these questions answered. So, example, teaching about the different types of breast cancer. So, depending on whether or not your cancer is estrogen responsive, you may have a different treatment plan than if your tumor is not estrogen positive. And, you may not know yet whether it's positive or negative, but you need to understand that concept because your whole treatment algorithm is going to be based on the subtype of cancer you have. So I think there's a really, really important role to educate people, knowing they're going to be embarking on a really long journey that is confusing. And a lot of people are confused and overwhelmed, and understanding big words and understanding, that there may be a tendency to shut down and just be more reactive and let things happen without actually realizing and taking a pause, like, wait, do I really want to do this? But if we empower you with the information about the disease and you understand it pretty well, then you go to talk to your doctor and like, well, actually, I want to do it this way, even if it's still a good path. Both are good paths, but that way you get a little more choice and you get a little more autonomy. So I think the navigating part in the beginning of a diagnosis is important to bring you up to speed on what you need to know about breast cancer, to help you make empowered decisions about your care. And then, of course, on the back end, if you're already a survivor, you may have already had to undergo treatments that impact your sexual health, your bone health, pain from surgeries. I mean, there's a lot of topics that are important that if you're on the back end, then we go through our survivorship handout, and we talk about really important things that you can do to stay healthy and, maybe answer some questions that are more pertinent to a long-term survivor. So you know, there's it's sort of like a master class in that topic that you're needing at that moment, and as a breast oncologist, I sort of am aware of things that that people need in those moments. But there's maybe also a role to help caretakers, right? If you are a child and your relative is going through cancer, you may wonder, well, do I need to quit my job? Are they going to die immediately? Do I need to come be with them? For what do I need? And in that capacity, I've also helped family members or friends who are trying to support their loved one, just to give like practical advice on how to support them in the best way, and sort of do's and don'ts, because there are times I've been educated by the people I've worked with who have said, you know what, when someone does this, that's really not helpful. And so I think there's a lot of learning um, that can be given back from experience that I think could help people.
I love that, Sarah. I have a girlfriend of mine who is currently actually dealing with this for the last few years now, meaning like her granddaughter was a young child. I think she was first diagnosed with cancer when she was about 3 years old. Child is 7 years old now, and it's been an on and off journey. But I mean, other than the child, the entire family is dealing with a ton of emotional, back and forth, and the impact of it. How does it, from a job perspective, mental wellness perspective, who takes care of the kid, who takes care of my mom?
Exactly.
It has been a horrendous journey. So I can see that being a holistic care for everyone in the family. And I think awareness itself, I mean, she had no idea what it meant. She and her daughter both did not have any idea what they would go through when the baby you know got cancer the first time. So yeah, but
I'm
I
sorry.
it's a very, very, very emotionally jarring, this thing. So
Yes.
in your current experience, right, when you first started this journey with my friend MD, your patients that have been within the clinical world with you, and now potentially transitioning to also get some level of coaching and counseling and guidance, what have their reactions been?
Well, my patients that I've been with for many years are awesome. And while I do not, I do not currently, practice medicine in the same way and see them in the same way, they have been really encouraging for me. The ones who are friends of me on social media, like Instagram, they're really, really great to show support. And I mean, I miss them, and it was really hard for me to make that move and leave them, quite honestly.
Mhm.
But I think it's been really neat. We're so connected in the world of social media, where some of the people that have just been so special to me I get to hear from them occasionally, which has been just really great. And also, everyone's been great about giving me advice, things like that they wish I had known. Like, I met with someone who was like, all right, let's come up with a really great list of things that I wish I would have known 6 months earlier. And so, in that way, sort of targeting education to where you're at, in an educational fashion, has been helpful. But a lot of it's driven by my former patients, who've just been teaching me, hey, occasionally they'll say, you've got to read this book.
Yeah,
I need you to know about this. Okay.
yeah. No,
So listening to them has really shaped me as a person and as a provider.
that's excellent. I think that's what it is, right? Like for a person to thrive, you need the help of the community, right?
Oh,
Whether
for sure.
through something as horrid as cancer, or
Yeah.
if they are launching a business or starting a new, career path. So I hear you. So switching gears a little bit here, right? I was reading an article the other day. There has been a forecast, and as well as an analysis, that there's a rise in cancer, and it has been steadily rising, and there's supposed to be a almost a 12% r- rise in cancer in the next decade. Um, I don't want it to be doom and doom, but I do want to comment on
Yeah.
what do you see that? Is that an I would say potentially honest forecast? I'm assuming it's based on a ton of research and analysis that has been done, but would love your thoughts.
Yeah, I think that while cancer incidence, so the new diagnosis may be on the rise overall, the actual mortality and death from cancer is actually decreasing. So as we have an aging population, age is obviously a risk factor for cancer. Also, there's lifestyle, so obesity, alcohol, smoking, a lot of that causes cancer as well. Um, so there's environmental factors, there's behavioral factors, but there's also a lot of medical advances that have led to those numbers. So now we have good information to say that doing a low dose CT scan can identify a lung cancer early in somebody who has a strong smoking history, which indicates you're getting a big population of people starting to do CT scans and catching a lot of cancers really, really early to the point where they're a lot more curable because you caught them so early. So adding in the low dose CT scan, all of our skin checks, our better mammograms, and the reduction of, time to get the mammogram at age 40, all of those things have led to us detecting a lot more cancers, but a lot of them are a lot more indolent. So again, the idea that the word cancer has fear, um, appropriately so in some cases, there's also a lot of sort of lower risk cancers that are now found more easily. Again, putting in a plug for prevention and screening. So I think it's a complicated issue. Certainly, there's clusters and neighborhoods, and the question of is there some environmental factor? Maybe. I mean, there's a clear link between Agent Orange, which was something that our military members were exposed to that has led to certain types of cancer. But there's also still the unknown factor where people may cluster in their families with cancer without a real clear indication. But I think a lot of people do think there may be an environmental component as well. Um, Genetic testing has helped because if you find out that there's a genetic mutation in your family and you yourself get tested and find out you have a genetic mutation, you will be able to get access to preventative screens. Like in the BRCA mutation population, women can have access to a prophylactic bilateral mastectomy, which means removing both breasts before even having cancer. So that was pretty famously discussed by Angelina Jolie as she became an advocate for that, which really helped to raise awareness. So I think the answer is really multifactorial and complicated, but I think overall, the fact that the mortality rate is going down is a great thing. So
I know you mentioned the environmental aspects, things that are more systemic that we potentially cannot necessarily control as an individual. And you gave insight into, as a medical profession, what the medical profession can offer us as doctors or healthcare administration. As an individual, what can I do to make sure that I can prevent or at least keep an eye out for things that I can control? What would you advise me to do?
I would say exercise needs to be a foundation for everyone. Obviously, that you talk to your doctor because you want to make sure there's no cardiac risk or things that we're unaware of. But in general, the guidelines for all cancer survivors and also to reduce the risk of getting new cancers is at least 150 minutes of exercise per week, which is about 30 minutes a day, 5 days a week, and 2 days of weight bearing. So I think it's really important to incorporate exercise. A lot of us get really busy in our day to day, and it's very easy to just let that thing be the last thing on our list of to dos. But it's really important for us to do that, and it does reduce the risk of getting cancer. Also, maintaining a healthy body weight. There are a lot of studies that show a high BMI is associated with breast cancer mortality at time of diagnosis, which basically means that if you keep yourself fit and, with a normal BMI, um, you're less likely to die of cancer if you get it. So those are really two important things. There's also lifestyle modifications that are important for breast cancer risk reduction. So there's some data that alcohol causes breast cancer and other types of cancer. It also there's also an association between breastfeeding, age of first child, time you started your period, time you went into menopause. So a lot of hormonal factors. So breastfeeding is felt to be good. Starting your period later is felt to be good. Um, having children, like so the idea of birthing a child is felt to be protective. But a lot of those you're not going to choose based on your breast cancer risk. I think it's good to know though. So environmental factors such as um, you know, environmental factors such as there's other things that I was thinking like, asbestos, like things that we find out later, oh man, that was in my house, some of those can be risk factors. But in general, if you eat a healthy diet, try to limit processed foods, which is really, really hard to do. Try to exercise and, limit alcohol, don't smoke, don't vape, wear sunscreen, go to your doctor at the right intervals to make sure that you catch something early. Have body awareness to advocate for yourself. So if you notice, like I have patients that are males that have had breast cancer, but because they don't think that males can get breast cancer, they diagnose them late. So if you notice that there's a red lump in your breast and you're a man and you're not thinking that should be there, you may say, well, it's probably a mosquito bite or it's this or it's my eczema acting up, and then it keeps growing, and then by the time we find it, it's a little bit later. So I think paying attention to your body is also really important. So if you feel like you're doing well and you're fine, that's great. But if something's wrong and you get the sixth sense that you need to talk to your doctor, it's important that you do that, because sometimes you can't figure out exactly what's wrong. But if you can identify a particular symptom like a new lump or rectal bleeding. I think it's really important to advocate for yourself with new symptoms. Even if you don't know whether they're a big deal or not, there's no harm in asking. And most doctors' offices have a plan in place for questions for their patients. So you can always, call the office and say, can I talk to the nurse? Or can I have the nurse call me back? And then they can be a go-between you and your doctor, especially if you're not getting answers. So just advocate for yourself to cover the what if factor in addition to trying to be as healthy as you can.
That's great advice. And I completely understand the fact that, that sometimes you may not think that it'll affect me, right? And either
Yeah.
because I'm male or I've never had it in my family. And you either don't at all think about it, or even if you do, it doesn't connect the dots in your.
Exactly.
So I'm also seeing a almost like a societal impact. It's not just awareness for me, but awareness potentially for a friend or a colleague or my kids or my spouse,
Yes.
family, that I need to be either aware of or have an open conversation that these are things that could potentially be signs of something much deeper. So.
Yes. I agree with that.
All right. This is a scary, but I'm liking the way you're approaching it, because it doesn't feel as overwhelming, as as the word cancer sounds. So,
Yeah. Yeah.
um, switching topics here, right? Topics as in gearing towards more from a perspective of paying for this health insurance, right? And that's it's a sensitive topic in so many ways, but a very essential um, uh, uh, topic, both from a need perspective as well as awareness perspective, right? Um, and we'll go with maybe start off with the maybe your viewpoints, and then get into the facts of how things work. But what do you think? how does insurance either help or hinder in giving the patients the care that they need?
I think understanding that they have the final say in a lot of healthcare is important. A lot of times doctors order tests and insurance says no. Um, so I think that while they might help cover some covered things, some scans that you might need. They might cover a hospital stay. God forbid, getting cancer. If you have the right insurance, they should be covering chemo. But that being said, you just have to ask a lot of questions about what your benefits are. Are your doctors in network? Because I've recognized that it's not a guarantee because you have health insurance that you're going to get all of the recommended care that a doctor would want you to have. And the way to ensure that you're doing everything you can to maximize that is number one, pick your plan. If you get choices, pick your plan. A lot of us have the work that gives us the plan. So in that case, you have the plan that you have and you may not be able to change it, but understanding the fact that when a doctor orders the test, it goes through panels and committees, which are often outsourced to intermediary companies. So you have your insurance, then your insurance will say, oh, in order to review whether to give the patient this test, I'm going to give it to this company and then this company. And it's like lots of people in between that can block the doctor ordering and getting you that test. So when you know that it's not as straightforward and simple, it's very complicated, and often doctors don't even know what's going to get denied. You can help us get that eventual appeal done and get the approval. So if you're really proactive, waiting on hold for many hours to get that test actually done is what we often have to do. I've had people with my team spending hours of time on the phone trying to advocate to get a test. And at the end of those hours, sometimes they still say no. And so if you can help us figure out on our end if there's anything possible that we can do, whether it be diagnosing, putting a new diagnosis code in the chart or faxing a different number, new records, I mean, whatever it is to help us get what we think you need, help us, because often they change their policies, they change their criteria for getting one drug or the next. So um, it's just not easy. So we try our best to only order things that your insurance approves, but even standard of care now is becoming denied pretty regularly. And I sometimes if you have the bandwidth to call your insurance company on our behalf and help us fight the fight, sometimes two people working on the same task is better than just one. So I've had patients, like, if you can, um, call that number, explain the situation, explain why they're denying it and what exactly we can do to fix it. And they might say a hard no. Like, I mean, my last peer-to-peer that I did was, I mean, again, it took 2 hours of my time to track them down and play phone tag. And they ultimately said, we're going to compromise. I requested 6 cycles of a particular therapy. They said, okay, I'll give you 2, and then you have to use the cheaper version of it for 3, 4, 5, and 6. And that was it. They just, it was no, no, and no. And then another medicine I had ordered, again, they gave me 2 cycles. And there was no words that I could say to change their mind. But at the very least, though, they did give those cycles. So if you didn't have insurance, you may not get anything. So I think yeah, sorry, I keep talking.
No, no, no. This is great. I think I just wanted to ask you, like, so as a patient or
Mhm.
a family member of the patient, the way I can help you and my loved one would be to not only understand how complicated this process is to get something approved, but also be helpful in calling my insurance company and holding them
Absolutely.
accountable as much as possible. Um,
Mhm.
this is
We have there's times when we know, let's say chemo has to start Thursday and insurance, has denied it. But and then our team's working on trying to get it approved. You're working on it, and all we need to get it approved is a number. It's a really long number. So, and it's like the authorization number. Okay, so without that, it's not happening. So we all are trying to get the number, and sometimes it's like right at like a couple hours before the patient's family will like call and leave a message, but I got the number, and they'll like, write it in a message, and then we copy that number and we put, paste it, and we can go ahead with the treatment. But I mean, it's it I did not know that it would be that complicated. When you go through medical school, you're learning which drugs and which treatments to treat the patients. And then in the real world, it's okay, I want these things to treat the patients, but what will insurance allow us to do? And all insurances have different algorithms and they change with time. So yes, if you can call them, especially if it's something like a PET scan, a CT scan, a breast MRI, and figure out what are the algorithms that your insurance requires, what hoops do they require for us to jump through? We'll help you. We're your advocate, but it's not easy. And so just knowing that it's not as easy as it should be is important information. Yes, the more phone calls you make to get those authorization numbers for us, the better.
And Sarah, would you be able to give us some direction on, meaning if somebody who's a layman does not understand what the complexities of what insurance can or cannot do for you, are there like websites or I guess links that a person could go to learn a little bit more who's going through this process of getting more insurance approvals for their claims?
I think the best thing to do is to talk to your medical team, because if you do not have cancer, you're not choosing your policy based on denying CT scans. So you really don't know what the future holds. But as soon as an issue arises in healthcare where your medical team is recommending a test, even having the follow-up question, do you think my insurance will approve it? Which oftentimes the doctor does not know. But hospitals will have a system in place to block it. So if your PET scan is scheduled for Thursday, and you show up Thursday, they probably won't let you do, at least in a perfect world, they won't let you do the PET scan unless you get that authorization number. So I think it's on a case by case basis unless you're choosing your plan altogether. But assuming you already have your plan, calling them to figure out about a CT in advance isn't helpful. But if the CT is being ordered at the time of the visit and you're used to having the doctor tell you that your specific insurance is being, difficult to work with, they're rejecting a lot of the things that they're trying to order, then as that test is being ordered, that's the time to call the number on the card and just say, my doctor wants this order. And then eventually after hours, you'll get someone who will say, okay, it's going to be approved. And then you have the peace of mind to know, yes, you can actually show up on Thursday and get it done. So I think that I would do it each time, you know, because you're not going to get a good answer about like what they cover and what they don't unless it's a very specific thing. And a lot of times they require documentation from your doctor, but which you're going to need the doctor to do. But yeah, if you can make any headway to figure out, what the algorithm is. Oh, I had to have, I can't get this drug, but I can get this drug after I failed this drug. My most recent denial this week actually was the insurance company required a medicine as an alternative to the one I ordered, but our whole pharmacy doesn't carry it. So the patient is coming to get the medicine and we can't even give it because we don't have it, and insurance only will approve the one that they don't have. Now, these are exceptions, so this isn't generally how it goes, but you just like once you get those denial letters in the mail, yeah, call them, explain the situation, advocate for yourself because you're like, this is what I need to treat my disease. Like, how can you block it?
Yeah.
We're trying to do the same thing, but I would take it case by case, which with each denial, that's your opportunity.
It's funny you mention about the denial part, right? Because I've heard and read up on the fact that when somebody hears that this claim has been denied, they think that's it. The road is closed, and you can't go forward. So I think
Gotta fight them.
yeah, it's good to be aware that that does not mean that's not the last decision. You can still go ahead and
Peer to peers.
yeah,
Yep.
continue that. And I know that there is a broader community slash societal pushback on making health insurance better, more accountable in general. In a perfect world, what would you suggest the first two things that once this change starts happening, what would you say were the first two things that should be tackled to make your life as a provider and your patient's life better? What would you recommend?
Gosh, there's so many. I think having access to the basic screens for everyone, with or without insurance. So the things that we know that we have evidence to support, such as, mammograms at 40, colonoscopies at 45, low dose CT scans for smokers who have smoked more than a pack a day for over 20 years. All of the people that we know will benefit from a screen, they all should be getting them. Um, and in the world of skyrocketing healthcare costs, I am hoping that things like AI can help to reduce some of the healthcare burden. And I know that's a topic that's important to you, but if there's a way that we can create MRI machines, PET scan machines that aren't as expensive, using AI, maybe instead of a test being 45 minutes, it can be 15 minutes, to allow for more scans to be done that day and hopefully reduce the read time for the radiologist so that they can be more efficient in their day. So there's a lot of advances that I'm hoping don't worsen the cost burden. I do get burdened by the cost of drugs. I
Yeah.
understand that. I understand they're expensive. It could take $1 billion to come up with a drug that ends up getting FDA approval, but it's hard to imagine us being able to sustain paying for hundreds of thousands of dollars per patient per year. So I do worry about the cost. So anything that we can do to reduce costs, I think would also be an important agenda item. I can't say I have all the answers to it, but I can just say that we're doing a lot of really cool things in oncology, a lot of cool therapies to try to improve outcomes, but they have a price tag that's very high. So we have to make a way that at least the basic healthcare is cheap, you know?
And in the meantime, I think it's on us as individuals to ensure we take care of ourselves. So
Absolutely. Prevention.
prevention.
Prevention is so important. And I think that focusing healthcare on prevention and like we just talked about,
Yeah.
the diet and the exercise and the limiting risk factors is really important.
So during this journey, with dealing with patients, learning, the art itself and the skills and dealing with the hospital administration, the insurance, and the myriad of things that you deal with being an oncologist, right? What were your most surprising and unexpected lessons that you have learned?
Hmm. I I think one of the things that I learned, especially in oncology, is that not all cancers are the same. I think we all think cancer is cancer, but it's really not. It's a lot of different types of diseases and some a lot worse than others. I've kind of have this vision in my head that I sometimes try to use analogies like cancers are kind of like hurricanes. And so there's like the tropical storms that you can live with. You might not even need treatment. It's there and it's no big deal. And there is the whole spectrum, and it can go to a category 5 that's very devastating for a family. So there's a spectrum of disease, and that hurricane analogy also applies to different types of organ cancer. So breast cancer has tropical storms as well as category 5s. but most breast cancer is curable, and most people are going to be, tropical storm, maybe a category 1 or 2, but they might do okay. They probably will do okay. And so I think understanding there's a spectrum of disease is helpful to not only have biases as doctors. So they're like, oh, you have stage 4. Sorry, there's nothing we can offer. Well, we're getting to a point where that might not be true. Sometimes there is something that you can offer. And um, sometimes you can have a curable stage 4. So I think that knowing that is really important. So before, yes, again, it's hard to not panic when you hear the cancer world, but actually getting understanding as to your type of cancer or your loved one's type of cancer is important because they're not all the same. And it's such a mixed bag. And we treat melanoma so differently than we treat breast cancer, so differently than rectal cancer. I mean, they're all different. And just because you've heard somebody tell you their story doesn't mean that their story applies to you. So I think, access to good information is so important because the bad information can lead you astray, and you may have a tropical storm tumor that you do not address out of fear and then becomes a category 5 when it was curable and treatable.
That's a great awareness. Sarah, in the myriad of patient personalities that you've had, right? I'm sure there are patients who are very reactive, very emotional, and then there are patients um, who deal with cancer or with a lot more clarity, peace, and strength, right? What would you advise not only the patient but the families on how to deal with this
Yeah, I think
level of clarity?
I think all of the, maybe behavioral modifications that you use to get through anything challenging um, need to be in place during a cancer diagnosis for the family as well. So imagine that going through this just by being told the C word in a room, there could be, maybe not for everyone, but there could be PTSD or post traumatic stress disorder. So it's possible to become so afraid of the diagnosis that you may make a decision that you would regret, whether it be running away from treatments altogether or from, just really upsetting yourself and your own stress level, which is counterproductive to your healing. Because at the end of your cancer journey, you're going to be a survivor. And as a survivor, you really want to become the healthiest version of yourself, not only to allow the cancer not to come back, but to retrust your body and to go back into life and still enjoy your kids and your family. So I think dealing with stress needs to be dealt with. And just because you're afraid the cancer is going to come back doesn't mean it will. But your fears are common and they're normal. And so the same way, you may go through a difficult season from the loss of a loved one where you have to, relearn to adjust into society. Um, you need to you need to check yourself and see whether you need those resources. So a lot of the mindfulness meditation, the prayers, the people involved in religion, a lot of that can give you strength, but really it's going to be very normal to have scary thoughts, and just know that those will get better with time, but actively come up with a way to heal the emotional side of yourself in addition to the physical side, because you may have pain from scars and surgeries, but it's really important for you to um address the psychological impact of cancer. And that goes for families too. I think for a family, if you're trying to support someone going through cancer, um, try your best to not give the suffering person your own anxieties, because especially if the person with cancer is an empath and they feel your energy and you are really anxious and really stressed out about their diagnosis, you being in their circle is going to give them extra anxiety, which you don't want them to have. So you can definitely be helpful, bring them dinner when they don't feel like cooking, and smiling and being supportive with them during chemo. But, if you want to be strong for your loved one, try to check your own emotions so that you don't look terrified every time you see them, because it's just going to scare them more. you
Yeah.
know Humor, for people that are funny, that might be great. Like, if you have that one funny friend that's supportive and just can keep you laughing, sometimes that's great.
Yeah.
um, but just be careful to check yourself, because they're suffering and they don't need more suffering because of your energy.
Yeah. And speaking of fear and changing the lens to you as a provider, I mean, you're dealing with this on a regular basis, and I'm sure there are days which are far tougher than other days. How do you take care of your own heart? How do you take care of on a day-to-day basis?
I think with time, you get better coping strategies. There's always going to be times when you really can't hold it in and you do have a breakdown. I try not to do it in front of people, and it doesn't happen often. But it is an emotionally hard job to watch people suffer. And it, especially when there's a bad outcome. And there are times when I don't sleep, and those times have gotten fewer between because of my own, like you said, rituals to try to keep myself as sane as I can while watching people suffer. But it's hard. It's hard. And I think I'm always going to have certain people in my heart, whether it be my patients, some of my loved ones. And, you know, um, not suffering is not part of life. I mean, you're going to suffer, but being able to bounce back to continue to, fulfill your mission is really important. So, life is a marathon, not a sprint. So, in general, there are days when it's okay to be sleep deprived. And in general, it's okay to have a day where you drink too much coffee and have a great time and eat too much. But just recognizing that everything that you need to have a good night's sleep, and the herbal teas and the not being totally attached to your phone at crazy hours so you actually can enjoy your sleep. I mean, it's really important. As much as I'm telling other people to exercise, I need to make myself do it. And I need to limit my own wine intake. I need to also pray. All of the things that people do to get through their diagnosis, I definitely need to do those things as well. And spend time with family, spend alone time, because it can become really overwhelming. It can.
Yeah. Uh, There's a rule I live by, and I love, by the way, I love the advice that you gave regarding being aware that life has ups and downs, and it's okay to be sad or stressed during the downtime, but and to also make sure that you're leveraging all the happy times with family, with yourself, all of that. But there's a rule in my life that I follow it that if 80% of your life is good, and what I mean by good is you have some level of decent health, you have a roof over your head, you have food, you have um, a prospect in your future, then you're okay. The 20% may be things that you carry as baggage, but that should not be the stuff that gets you down. So I like your advice. Um, Sarah, where can people find my friend MD?
Well, right now I have my website, which is myfriendmd.com, and you can grab my email. If you log in and create a profile, I'll email you. So, and I'm also on Instagram, Sarah with an H, so SARAH friend, FRIEND MD, on both LinkedIn, and Instagram and TikTok. So
And I'll provide
that,
all the details in the comment.
thank you.
Absolutely. Yes.
Thank you.
And any books, resources, or community that you would at on a broad stroke that you would advise people to read about or listen to? And you
There's a lot of really great podcasts and a lot of really great books. I like the book Outlive. it's a book that is talking about prevention. And that is a really important concept, especially for people that have never been diagnosed with cancer, but want to just keep themselves as the healthiest version of themselves. So it's, maybe not accepting the pre-diabetes hemoglobin A1C. Maybe let's talk about treating it a little earlier. And maybe let's have a little more rigorous standards in our healthy patients who don't have any chronic illnesses to keep them healthy. So I think that's a really good book that sort of inspired me and gave me some great ideas on, especially on, tips to keep people healthy, which is where I think healthcare dollars should go.
Yeah. And the same, I'll provide the names of the books that you have referred at the bottom in the comments if anybody wants to take a look at that. All right. Today's conversation wasn't just about cancer, it was about care and about what it means to show up for people when they're most vulnerable, to challenge a broken system, and to create new paths where none existed. To our listeners, if you or someone you love is facing cancer, I hope this episode reminds you you're not alone. There are doctors, coaches, and human beings like Dr. Friend who are building bridges between clinical care and compassionate present. For myself, personally, conversations like this are why I started Caffeine and Concepts, to bring light to the innovators, the breakers, the caregivers who are challenging industries from the inside out. And to you, Dr. Friend, thank you so much for your honesty, your fierce commitment, and for choosing to be more than just a doctor. You're a guide, an advocate, and a much needed friend to many, many, many people. Thank you so much.
Thank you so much.
Well, until next time, if you have any questions, please go ahead and add it in the comments or reach out to Dr. Friend directly on her website. Thank you.